Hello, everyone. Welcome to GINA's NP Week celebration. I'm Jensine, APRN Chair for Georgia Indian Nurses Association. Thank you all for joining us on our third interactive Q&A session this week. We are excited to have another nurse practitioner leader from Illinois, Dr. Simi Joseph. Our topic tonight is terminal degrees for nurse practitioners, DNP versus PhD. The president of GINA, Deepthi Varghese, will also be co-hosting with me.
I have the pleasure of introducing Dr. Joseph. She is a gastroenterology nurse practitioner for the GERD program at Esophageal Center of Northwestern Medicine, Chicago, and the former director of clinical operations at GI Solutions of Illinois. She has 22 years of nursing experience and 12 years of gastroenterology nurse practitioner experience in the United States. Dr. Joseph received her baccalaureate in nursing from Manipal Kasturba Medical College, India, master's in adult nurse practitioner from North Park University, Chicago, DNP from Loyola University, Chicago. She is now pursuing PhD in health sciences from Northwestern Illinois University. She serves as an adjunct professor at Benedictine University and an international faculty at Manipal College of Nursing, India. In addition to her advanced degrees in nursing, she completed her postgraduate training in clinical research from Harvard Medical School and Joanna Briggs EBP Institute. She is a national speaker, researcher, and brings a wealth of experience in gastroenterology specialty services. Proud moments of her career include being honored with the Nurse Practitioner State Award for Excellence by AANP in 2016, 40 Under 40, Emerging Nurse Leader Award by ANA in 2015, Best APN and Nurse Leader Award by INAI, Nursing Excellence Award for Clinical Practice, APRN by NINA in 2018, and Creativity in Practice and Education Award by National Academia of Practice. She has held many positions in the board of Indian Nurses Association of Illinois and currently serves as the Executive Vice President. Please join me in welcoming Dr. Joseph.
Thank you, Deepthi and Jency, and thank you, GINA Georgia, for having me while we are celebrating our National Nurse Practitioners Week. I'm so excited to share what I know about the differences between Doctor of Nursing practice and the PhD. And thank you for joining live. There might be some nurses who love to hear about this topic, and all are welcome to join us and have some interactions.
So our first question for you, why should nurse practitioners get a terminal degree?
Interesting question, right? I do have a few slides to pull up, so let me share my slide so that people can visualize as well when I talk. Sometimes I kind of tend to forget the things, so they can go back and look at it. So there are a few reasons I wrote it, why a nurse practitioner get a terminal degree. When I was graduating in 2008 with my APN degree, at that time there was a talk about, doctorate in nurse practitioner is coming up and it's going to be mandatory by 2015 at that time. So it was like, usually I always look into the things to do ahead of the time. So I was worried, okay, I will fall behind, if the DNP comes up in the future and NPs are going to be graduated with the DNP degree and we don't know whether we will get grandfathered or what's going to happen, right? So that is one of the reason. Also, I took DNP when the program came, and especially in Illinois, a few of the colleges started, and I was couple of the initial cohorts in Loyola. So that was kind of quite an experience, because they were also learning through, how to build up a curriculum based on clinical practice. So DNP will be a standard entry level required for APNs in the future for sure. So that's the one reason. Another reason is the shortage of doctorally prepared nursing faculty. It's a nationwide shortage of nursing faculty, and they want a PhD prepared or DNP prepared faculty to teach their, BSN degree or RN to BSN program, or even the DNP program. So there's a tremendous shortage on that. And if people are interested to join universities in teaching, or maybe a part-time job, you should be thinking about the doctorate in nursing practice. Then the other reason is the current healthcare demand. So now the healthcare is, it's turning into a different direction. Now, I don't know, when you're working in a hospital setup, the value-based care, it's more talking about, when you come into the patient care side. So everybody is looking at the health outcomes in patients. So you need a comprehensive skill set for understanding the scientific knowledge and leadership qualities to bring the best practices in order to bring a patient outcome, or even organizational-wise the health outcomes, or even, personally, in your patients, bring a good health outcomes. So I think that is another reason DNP is contributing to build these skills in, through that education. Another one is the professional responsibility. So once you grow in a profession, after a few years, we all know that we wanted to get something more, some new skills. So it's like a contribution that you're doing to the research side, or even the clinical initiatives to advance the healthcare delivery and improving the clinical outcomes in your area of patient care. The last one I thought is the career goal. Initially you probably thought, okay, I just wanted to be a nurse practitioner. But once you are an NP in a specialty or anywhere, you feel like, okay, I wanted to advance my career as a researcher, or maybe an expert clinician. You are expert in something. I'm also I'm expert in gastroenterology, and after 13 years of working in an area, you became, the expert in that field. And especially, I moved into a GERD program, which is kind of a more focused clinical outcome in a patient. So I become a expert in GERD treatment and management. So I would love to see my patients improving, in my patients' clinical outcomes in the gastroesophageal reflux disease. So I wanted to do some research, or I wanted to do something for those kind of population. So these are the career goal you have to think about. You wanted to be a leader in your area, or in an administrative position, or you wanted to be a educator and in the universities to teach, or you wanted to do completely research. That's all for the first question.
So can you tell us a little bit about the main differences between DNP versus PhD? Good. So I pulled up a few differences, which is the major differences, okay? The DNP is a practice doctorate, and PhD is a research doctorate. So both are now considered as a terminal degree, but there are differences, the major differences. One is the DNP is preparing nurse leaders to improve patient outcomes, and we are focusing on translating the bench research or whatever the research was done in an area, and we have to bring that to clinical practice, right? It's not to sit in a paper or in a publication. You need to apply the research in your practice. So DNP is preparing nurse leaders to improve that area of clinical outcome. Then PhD, as you know, PhD has been
care for many, many years. So it's preparing for nurses to conduct research and advance the science of nursing. For DNPs is a postmaster's program, and the requirement for most of the universities is at least a minimum of 12 months. They should have this program and also a completion of a DNP project. It doesn't have to be a research project, but it can be a research application kind of. For PhD, it's average, it takes 4 to 5 years, depending on your, the first you do core courses, and then you do a PhD candidacy exam. That means you qualify for a PhD dissertation, and then you do your dissertation, and depends upon your dissertation length. It might take another year or 2 years. So that's why it's kind of 4 to 5 years. For DNP graduates, it applied research into clinical practice. For PhD, the curriculum is teaching you to generate new knowledge by interventional trials or bringing scientific phenomena or expand the body of science. The curriculum, basically the DNP is focusing on strategies and approaches for evidence-based practice, which is EBP, and this impact on the practice outcome. And PhD curriculum, as you know, it's basically theory and research methodology and philosophy of science. The other few differences are the career. It's a commitment to practice career, DNP career is, and improving patient outcome and population health is the focus. And PhD career is committed to a research career. Basically, if you're doing a PhD, you just wasting your 4 or 5 years if you're not doing any, research work in your future. So you basically have to think about, are you really wanted to go into PhD and do some nursing research? Number 6, the resources. You need to think about when you are approaching a DNP or PhD, do I have some mentors? Do I have a preceptor which can guide me throughout this process of program? Some of the universities, they have resources like, in my university or my university in the sense academic facility have APN committees, which helps the DNP students, those who are DNPs, they're helping those who wanted to go into DNP, they're mentoring and precepting them. So those kind of resources, it will be helpful, and nursing organizations are doing it, right? GINA is doing it, INAI is doing it. So we have our own DNP graduates, so we help our members, who really wanted to go into DNP, we connect with them and we help them to get mentors and preceptors. So that's very important. And PhD, if you're thinking about PhD, it's basically you need to be in a research setting. It's really helpful. Otherwise, it's very hard to do a research dissertation when you're in a PhD program. You need to have an access to a research setting, access to a dissertation support. You need to have a PhD or even clinical trials, and those things are going on in your work area. They're our mentors. They can guide you for the process, and you also should have some funding and everything for the dissertation. So that might be a area that you need to think about, at your current workplace, whether these resources are there. Otherwise, you will spend a lot of time wasting because you need to have a lot of grants for, funding for your research to be done. So that's one of the reasons I moved from private practice to academic practice in the middle of my PhD program. So I thought, I'll have better resources to finish my PhD if I'm in an academic practice. Number 7, the program outcome. The outcome for DNP, we want those who are coming out of DNP, they should be focusing on the healthcare improvements and their contributions via practice, policy changes, and advancing the healthcare delivery. PhD program outcome is contributes to healthcare improvement by developing new knowledge and the scholarly publications or products or research, which provides the further advancements for the nursing science. So these are the major differences. I hope everybody got an idea. I recently saw an article which was published about DNP versus, why DNP versus PhD kind of. So in that article, I saw some interesting finding because the first annual DNP conference was held in 2016. I graduated in 2014. So after that, only the first DNP in a conference came in. So they discussed about, what we have achieved through DNP program in these years, what we should look into, changing the curriculum or something different. Because there's multiple different curriculums in the country, and they're focusing on improving that. It's great improvement has made. So those discussions, some of the discussions which was kind of a little important is DNP is a credential. It's not a role, It's an advanced practice nurse with the credential of doctorate. And DNP refers to a set of knowledge and skills that is applied across different settings to improve care, quality, cost, and outcomes. So if you're a DNP graduate, if someone is hiring you, they know that you have this set of knowledge and skills. So that should show in your credential. So that's the reason I'm hiring this DNP credential, the APN, so that I can utilize her better in my practice to improve patient care, quality, cost, and outcome. And DNP programs are rising in the country. It's far, big difference by PhD program and DNP. DNP is like double or triple the PhD programs now. It's a good thing is it's drawing new nurses into the practice, but there is a concern that they're pulling nurses away from the traditional PhD research career, because it takes that, research career takes 4 to 5 years. And everybody's thinking, oh, DNP, I can get it in 1 to 2 years. It's both are terminal degrees. But if you have to think about what is the outcome you're getting from this program. I struggled after I got my DNP. I wanted to do some clinical research. I struggled to have that skill set from DNP program, because that's not the skill set that you get from the DNP program. So you really have to think through and see, even if additional few years you have to spend for PhD, if that's what you wanted to do, you should. It's not like, okay, I can get my doctorate in 2 years so that I get the name as Dr. So-and-so, so I can do whatever. So I think you're going to be struggling in future if you decide based on that doctorate degree. But there are some NPs with a good resource and experience. They are doing research. I'm not saying they're not doing research, but they're in the right setting with a lot of collaborative research with other PhD nurses or nurse practitioners. You can learn from them as well, while doing few research with them. So just kind of, wanted to talk about that. And there was a discussion on appropriate practice setting. They're still discussing like what is MSN and NP graduates and what is the role of DNP NP. Are they still doing, going to do the same thing? So that separation hasn't reached yet. BSN and NP, after a master's program or after you become a nurse practitioner, how many months it takes for you to get a confidence in your practice. I remember it takes me like another year to be independently, confidently practicing in my gastroenterology area, even though I knew a gastroenterology area before I was a nurse in the GI lab, but still the NP role, the transition of that NP role is, a little difficult. So you get through that, and then you think about DNP, that's appropriate. DNP is preparing nurses to meet the current healthcare needs and also the future. There is considerable variability among DNP programs that remains a threat to the country's, nursing programs, but hopefully that they are, going to fix that part. And DNP prepared APRNs can help bridge the gap between research and clinical practice. So now what's happening is the research and clinical practice is entirely different. There's no connection between the both. Those who are doing research have no connection between what NPs or nurses are doing in the clinical practice. So they are hoping the DNP can be a bridge between the two. Those who are in the research area as well as in the clinical practice, DNPs can be a collaborative personnel or the nurse practitioner who can help to close this gap.
Thank you for breaking that down for us, really differentiating between the two terminal degrees. For those of us who are considering a terminal degree, can you offer some advice on how to choose which one fits the individual best?
So I would say, considering what I already talked, just have to think about your long-term goal. But in the same time, I would say I didn't know my career goal in the beginning because I just wanted to work as an NP. But you're at some point you will realize what you wanted to do in the future. I think that comes maybe after a few years of practicing as an APN. You will realize what's your strength and what's your weaknesses and how you are, helping yourselves to cut through that. For example, when I was a graduate of master's degree here, I was a BSN graduate from India. So you haven't done a lot of presentations or writing or anything, when you're a graduate from India, right? It's a long time ago. So the MSN program is something different here. It's like Indian graduates, it's very difficult. So once I graduated, my first goal was to present in a conference because I was so scared to present at one of the conferences. So then you will realize, okay, that's my weakness. How will I get through that weakness? So I started applying, I started to write abstract, properly, research how to write an abstract. And then I submitted to 2-3 local organizations and see, and okay, whether it will get accepted or not, then I will go from there. So that's how I developed, and I basically beat that, fear about presenting in front of people. And then I became, confident in that. So after a few years, you will realize, okay, I can be a speaker. I can be a writer. I can do some, better clinical work. So that even develops your long-term vision and long-term goal. Then are you interested in continuing clinical practice? You just wanted to be in a clinical practice and advance your APN expertise, as well as, you wanted to be in an administrative role, then you take DNP. If you're totally interested in teaching, any of these degrees are good. Both prepares you for, there's no preparation for academia, basically. That's what the curriculum is not preparing you to teach, So it's basically you're acquiring knowledge through the DNP program or PhD, and then, the teaching skills is the one that you need from both the degrees that you teach. Nurse leader, if you wanted to be a nurse leader and expert in the advanced practice, then it's a DNP is your choice. And if you wanted to have nurse scientist job or a researcher in academic institute, the PhD is a better way to go. So I would say the DNP and PhD are complementary degrees in moving the discipline of nursing forward. So both are good in a different ways.
Thank you for sharing your advice on how to choose between the two terminal degrees, Dr. Joseph. So, you already have your DNP, now you're pursuing your PhD. Can you elaborate more on what made you pursue your PhD as well?
So it's a personal goal, as I was talking about earlier. And I really wanted to say a few things about my personal story, how I got interested in PhD degree. I wasn't even thinking about PhD career because I didn't want it to be in a teaching side, basically, because I like patient care. I like everyday patient interactions, and I felt like I'm the best in doing, hospital rounds and taking care of patients and the families, being an advocate. The job satisfaction is skyrocketing, when clinical outcomes are good in patients, right? And you get an appreciation from the family or the patient. So kind of, I love that, but then, as I was mentioning earlier, the DNP is going to be the terminal degree. Then I decided to go to take my DNP because I like clinical practice. So DNP is for clinical practice. So I took DNP. So after the DNP, I was telling you, when you take an advanced degree, you develop some skills and more knowledge on healthcare or population health and a lot of things that you learn through in that couple of years. That is kind of a guiding you to do some leadership things in your organization or in your workplace. So I got involved in my Society of Gastroenterology Nurses and Associates. It's an organization for GI nurses. So I started getting involved in that organization, and they had an opportunity for being a nurse scholar program. So I applied for that. So I wanted to see, it's a collaborative work between GI nurses. So that was kind of a big experience for me to get trained for systematic reviews. So they helped us in a couple of seminars, and it's basically a 1-year program, and had 2 sessions in person training about systematic reviews from the Australian program of JBI, Joanna Briggs Institute. And they had a pathway that how we write the systematic review and what's the process. So it was a good learning process. So me and one of the GI nurses from New York collaboratively published a couple of studies. So that was quite a bit of interesting. Then I started involving in clinical trials at workplace because, in any specialty practice, there's a lot of companies, ask you, okay, do you want it to be a clinical site, trial site? So I was only one nurse practitioner in my 4-physician clinical practice. They always relied on me for extra work, right? So it's like an extra work to do a clinical trial in a private practice. But we had a lot of patients. So I thought, okay, I'll take up that. So that's how I interested more in clinical trials. So we did 2 phase 3 clinical trials in the practice. So I was the research coordinator for that. So it was very interesting to get the consent, going through the IRB process and submitting from the site side. I was the contact person for submitting, and I was the contact person for collecting the data and uploading into their site. And the final outcome was interesting to know. So that it got me into this Harvard program because I wasn't thinking about PhD. I was like, okay, I need to learn more about the research skill now, because I don't know, a lot of other things that detail about statistics or how to look at a Bart's plot or a graph or anything and interpret that. What's that? So I was like so nervous myself, what I'm doing, involving in clinical trial, but I don't know in my mind. I need to get some education for, what's the research side in GI or whatever. So that's why I got into that Harvard program, which was a great help for me to transition into PhD program. The Harvard program was for all the doctoral degree people. So it's from all over the world. They selected 100 people for this program. So they were actually training us to be a global leader in clinical research. So it was like basically statistics and going through the entire research process. The final project was a research proposal that we have to individually write and pass, because reviewers will, correct our paper. And also the team they gave us were from 5 different time zones. So each people were divided according to that. They wanted to know how we work together in different time zones, from China, from India, from US, and from Korea, wherever, So it's up to us, we got to finish our project. That's all. They don't give any other guidance. So we got to figure out, how we meet every week, how we figure out. So that's the future. Future of collaborative research work. So it's all kind of interesting things happened in my life. So that's the reason I pursued a PhD, and I wanted to be my passion plus my future goal was to get into academic practice. So academic institute, it's really good if you have PhD. In my current role, I'm involved in a couple of clinical trials. So you basically now it's very easy to understand the protocols, and I see the patients who are in the research protocol. In Northwestern is known for a lot of research, so they do many clinical trials. We have eosinophilic esophagitis, at least 10 drug trials going on. So they need APNs to see the follow-up patients. To take care of the patients, and those 2 or 3 physicians cannot handle all these 10 clinical trials, right? And they have the protocols to follow. So the research team needs APN's help. So I'm also involved in that aspect. So it's very interesting career going on. So the PhD is really helpful at this point.
Thank you. You made research sound very interesting. So one more question. What are your thoughts on addressing nurse practitioners with a doctoral degree in the clinical setting as Dr. So-and-so?
I was, when I saw the question from you, I was thinking about it, and I also researched a little bit. So major organizations like American Association of College of Nursing and Nurse Association of Pediatric Nurse Practitioners, Emergency Nurse Association, AANP, everybody is written. If you are getting your terminal degree, either DNP or PhD, you are entitled to be recognized properly. So you don't have to be shy away from that. You can proudly say that you have earned the doctorate degree. So even if it's DNP, I know DNP is, there was a big debate when I graduated also, whether people should be, calling. But all the health sciences now have a doctorate degree. So they're earning it. They're entitled to be, called as Dr. So-and-so. And it gives patients, I think from my experience, the patients are getting some great confidence in a caregivers. Like, I'm taking care of a patient myself, right? So if they know that I'm a person with a doctorate degree in nurse practitioner, the value is the big difference. Big difference. Their confidence on us is doubled if you have a doctorate degree, because they always ask, oh, you are a doctor. Then I have to say that, oh, I have a doctorate in nursing. So when you address yourself in a patient side, clinical area, you're supposed to address as Dr. Simi Joseph. I'm a nurse practitioner. So you have to do that in all the organizations I've written. You have to address correctly. But some of the physicians, I know some physicians don't, there's debates between, how the doctorate degree should be called. But my previous collaborative physician, once I got my doctorate degree, he never hesitated, when he introduced to the patients, he will say, he was so proud. He'll say, this is Dr. Simi Joseph. She's a nurse practitioner working with me. So he always addressed me with doctor. So it's only rare, like physicians confidently say that. So
Thank you, Dr. Joseph. This has been so insightful, and you are a wealth of information. This has been really good.